therapy, also known as hydrotherapy, is derived from the Greek word hydro, meaning water, and therapia, meaning healing. It has been used to facilitate healing since the beginning of time and across many cultures. Hippocrates was the first to use hot and cold water to treat a variety of diseases. The Romans and Japanese followed suit by constructing therapeutic pools in their empires. The United States caught on shortly thereafter and used it to treat defects of the mind and body. Aquatic therapy transitioned from a preventative and recreational role to a rehabilitative role during the polio epidemic of the 1940s and 50s. As all of our viewers can remember, on November 17th, Kayla Tunyas, Olympic figure skater, was seriously injured in a practice session while training for the upcoming 2014 Winter Games. She sustained serious injuries, including a shattered hip and several fractures throughout her arms and legs. She is currently undergoing extensive therapy in hopes of regaining status to return to training. Kayla has been participating in aquatic therapy along with her regular occupational therapy sessions. Let's take it to reporter Erin, who is live in front of the Simon Recreation Center at St. Louis University to bring us up to date on Kayla's most recent care, as well as insight from Kayla's mother and occupational therapist.
We're here today at the Simon Recreational Center. I'm going to be talking to Olympic figure skater Kayla Tunyas and talk to her a little bit about her aquatic therapy, and also her mom will be there. So I'm really excited about that. We'll also get to talk to her OT about some of the things that she'll be doing today in the pool. So get excited. Kayla Tunyas and her mother, just to talk a little bit about their experience right after her injury. I just wanted to ask you, how were you affected by her injury? Did you do any kind of research beforehand? What was your experience?
Well, due to the severity of Kayla's injury, she had a really hard time getting around after her accident. So we looked into a lot of different things. Aquatic therapy seemed to be the best fit because after being in a wheelchair for so long, now she's up and moving around with her walk.
Looking good, looking good.
I'm definitely starting to feel differences in my mobility and pain too. Well, so before we chose aquatic therapy, we looked at a few research studies and wanted to look into all the different things trying to see what was the best fit. And we saw that a few of the studies showed that it was really helpful with pain management, reducing pain, and increasing mobility. We saw it particularly applied to autism research. However, when we asked Kayla's OT what she thought, and she thought that it would work for her, she thought that it probably would. So OT seemed to make her its own.
Really cool. Seems like you've had a really good experience thus far. Okay, so I think we're going to talk to your OT next before we get to your session and get going. Allison, Kayla's OT. I just wanted to talk to you a little bit about, what are some of the techniques you're going to be doing in the pool today? A little bit about aquatic therapy.
Okay. Well, techniques of aquatic therapy vary and are often specific to injury or condition. There are exercises specific to improving flexibility and strength training, as well as ambulatory exercise for therapeutic swimming. Certain injuries will require personalized programs, while others have sought the benefits of exercise in the water. In Kayla's particular case, we do single sessions weekly using adaptations such as noodles and water weights to improve her mobility. And there's also a lot of different types of aquatic therapy techniques. So to name a few, it's IG, aquatic PNF, back cab, and fluid moves. But with Kayla and her occupation of ice skating, I decided to use a technique called the Aquatic concept, which uses rotational patterns to improve balance and postural control. And in addition to that, I use a technique called Watsu, which involves moving one of the affected limbs at a time, which is focusing on that.
Very cool. It looks like we'll be getting to a lot today in the pool. I'm excited. We're here at the pool with Kayla and her OT, Allison. Can you tell us a little bit about what you're going to be doing today?
Well, first we're going to start with 5 minutes of the Aquatic concept, which, like I said, was rotations and working on balance and flexibility.
I generally do a little bit of a warm-up because for me personally it's hard to get into the techniques used, so I will probably do a warm-up as well.
So I think after we warm up and start with the Halloween concept, we're going to do 5 minutes of Watsu technique.
Okay.
So we're just going to work on moving like one arm and then maybe one leg and then switch to the other side. Maybe do some floating. We've got this lovely belt on.
Looks great.
Looks great, looks great. We've also got this noodle. We're going to work on some maybe kicking.
Okay.
So she can get some motion going.
Nice.
All right. A typical therapy session starts with a 5-minute warm-up, the techniques used, and then a 5-minute cool down. So we're going to start today with the warm-up of Kayla's choice.
The exercise that I find like helps me to get my muscles in a state of where I feel like I can use them better in the water is just a walk from side to side in the pool. So I think that's the warm-up I'll choose today. It's a little bit difficult considering I use a walker to walk outside of the pool, but it's definitely easier for me to move in the water. I hope to be able to do this by myself within the next few weeks or months.
The belt that Kayla's wearing today is helping her with her balance and helping with flotation just because she is in a lot of pain still and she can't really walk very well.
Whether a meatball marinara with jalapenos or a low-fat sweet onion chicken teriyaki with banana peppers, you can always be yourself at Subway.
Earlier today, Aaron was in the studio with Heather Wilson, an occupational therapist who administers aquatic therapy, for another insight into the role of aquatic therapy.
What does aquatic therapy mean for you?
So aquatic therapy to me is a great counterpart to typical land therapy for patients. It's really motivating to them because it's a different environment and a lot of movements are easier to do in the water than they are on land, so it's a good place to kind of start for some patients to learn techniques and then be able to carry them over to the land environment and to the home environment.
What does a typical session look like?
A typical session in the aquatic session, a pool can really vary between types of patients, but the main things we look at is some different techniques to use, like water itself has buoyancy, which makes movements different than land, because land has gravity, so we're working different muscle groups. For instance, like on land, when you do a basic bicep curl, you're using your bicep against gravity and your tricep is assisted. In the water, it's the opposite. So buoyancy is going to pull you up. So you're assisted into flexion and you're working against buoyancy to extend your elbow. So we kind of are able to use the property of water to strengthen the anti-gravity muscles, or the strength of muscles that are assisted by gravity mostly. We also can use buoyancy of water to help patients do movements. So like we can use buoyancy to float on top of the water in a technique called Badragaz and use that buoyancy of water to help them kind of just shift on top of the water and strengthen muscles in some different ways. Like we'll hold on to them and have them push and pull into us while they're floating, so they're able to strengthen their muscles that way, or they'll try and resist us while they float on top of the water, which is what Badragaz is made up of. Another thing that we can use is use the property of buoyancy in a technique called Halloween, which helps patients learn how to swim that might not have all
all the muscle groups that we would typically use to swim, and it's about learning to use your center of buoyancy in the water in a different way to swim. So instance, a patient that has a spinal cord injury that doesn't have movement of their arms and legs can learn to get their body in an upright position and float with their center of buoyancy, which is kind of up around your mid-chest area, and use even just shoulder movements to swim. So they can be really independent in the water. So we see that with a lot of patients that aren't able to move on land. They can move in the water and it's very freeing for them, and they're able to actually use muscle groups that might be too weak that they can't use on land. And the other main property of water that really helps is being able to have the resistance of water. So every time someone's moving in the water's resisting their movement, so every movement is able to strengthen. And then we're also able to use movement in water. We can create waves and create different ways for them to fight against that movement to try and keep their balance, whereas on land, we don't really have those things working against us. So it's really good. It supports patients, but then it also helps them be more challenged in muscle groups that they normally wouldn't be.
Aquatic therapy. What kind of training do you need to have?
There aren't any set qualifications right now in order to say that you're doing aquatic therapy, so I try and explain to a lot of my patients to really be aware of what background their therapist has. Technically, anyone can go right now and say they're doing aquatic therapy. There is a certification, but it's not a mandatory certification. And a lot of people don't get it because of the cost and time involved. But what we really encourage and what we do here at our staff is we make sure that people have gone to continuing education, because like I've talked about, the properties of water are different than land, so you can't just go in the pool and do exactly what you do on land and expect it to be a normal session. So I really try and encourage families if they're looking for someone in aquatic therapy to make sure they've gone and gotten continuing education. They know basic water rescue for safety reasons, and that they understand and have had some experience working with patients in the pool. One of the main reasons I think it's important that our therapists have gone and gotten some continuing education is that there are contraindications for getting in the pool. For one, if someone has a trach or some sort of artificial airway, obviously we don't want them getting in the pool because we don't want water to get into their lungs. But anyone that has a wound or there's also heart conditions that, especially if it's a warm water pool, could be harmful to their health if they got in the pool. And the pressure of the water, the hydrostatic pressure, can also affect people with kidney diseases. So those are things that we want to make sure that physicians have signed off on and are okay with the patient participating.
What is the most common type of condition that is treated with aquatic therapy?
So here I work with a lot of kids with a lot of different conditions. The main ones we get in the pool would be any kind of diagnosis where there's weakness. So something like CP or a spina bifida type of diagnosis where there's muscle groups that we're trying to strengthen. We also have a warm water pool, so anyone with spasticity, again like in CP or a spinal cord injury, we can use that warm water to help relax their muscles for stretching. We also see a lot of patients that have weakness and have issues with joint integrity, such as in osteogenesis imperfecta or JRA, and they need that water to take away gravity so they can do movements without the impact on your joints that they would have on land. And then we actually also use the pool for sensory integration patients because there's a lot of different sensations going on in the pool that we can use to help do some desensitization and also some calming activities as well.
What do you think are the benefits of aquatic therapy?
I think the pool is really beneficial because patients, first of all, tend to be very motivated because it's different than doing something on land, and they tend to be pretty successful. And also we're able to target muscle groups that are more difficult to target on land, and we can really challenge some muscle groups such as core strengthening muscles that on land individuals can learn to compensate for pretty easily by sitting with poor posture, or in land or in the pool because of the movement of water they have to be constantly recruiting those muscles to maintain their balance.
Now we are going to take it back to the Simon Recreation Center to check in once again with Kayla and her outlook on her treatment, progress, and training.
Kayla Tunyas, after her recovery, just to catch up with her, see how she's been doing after her aquatic therapy, and just get to know a little bit about what she's been doing over the past 8 months. How do you think aquatic therapy has benefited you?
I think the aquatic therapy will allow me to kind of keep increasing my range of motion in my injured limbs and regain strength and flexibility, and also decrease the amount of pain I've been having. And this is all things that it has done, and I think I continue to see it weekly, especially in more mobility and definitely a decrease in pain since the beginning. I hope it kind of has served as a way to help me get back on my feet, and I'm going to kind of stick with it for a while yet. And I definitely think it's been made a huge impact on my recovery. So.
That sounds awesome. What, if anything, will you pull from your aquatic therapy sessions for use in future training?
I definitely think I'm going to continue to use water to condition my muscles and hopefully regain my strength and my movement that I once had, because that's been really difficult now since I'm still in the stages of recovery. So I think once I'm at that point, it'll be really beneficial for me to continue to use water as a form of training. And many ice skaters, they use a variety of settings to train in. So I think I'm going to definitely start incorporating the pool as well as the exercises that I've been using with my therapist to improve and definitely, be strong for ice skating.
Very cool. How do you feel about your upcoming return to the rink?
I'm really excited. Yeah, I'm really excited. I've missed it, definitely. I think it'll be a challenge for me at first, when something was so routine and then you can't do it the same way. I think it's definitely going to be a challenge, but I think I'll get back up to where I need to be, and I think you guys will all see me in the Olympics.
Oh, yes, we're excited about that.
Yeah,
Good luck.
Thank you.
I'm Mary Georgian. Stay classy, St. Louis.
Today in St. Louis, we're going to be speaking with the Olympic. Are at the St. Louis. Dang. Okay, for real.